Why don't you go ahead and get started, and hopefully Stephanie will join us very shortly.
Okay, everyone can see my screen? Okay, well, hi everyone. To anyone that doesn't know me, my name is Christina Kasprzak, and thanks to Lucia for that awesome introduction. And the title of my dissertation research is Evaluation of Pre-Implementation Capacity and Implementation Effectiveness of an Evidence-Based Intervention for Mobile Produce Markets. Quite a mouthful, but that's how dissertation titles go. So first, some background on mobile produce markets and their role in public health. So first, to the problem. We recognize that there are disparities in diet-related diseases among underserved populations, and low fruit and vegetable consumption may play a role in these disparities. Limited access to healthy food, including fruits and vegetables, has been identified as a barrier to consumption. And in response, there's been a rise in research and strategies aiming to understand and influence the food environment. But our relationship to the food environment and then how we eat after is pretty complicated. It's not quite as simple as just bringing a supermarket into an underserved community, unfortunately. Mobile produce markets, or mobile markets, are one food access strategy, and they're small markets that travel to communities to distribute and sell fruits and vegetables, and they've really grown in number and popularity in recent years. What we know so far is that mobile markets are a viable solution for improving the food environment through increasing availability and access. And the evidence is really growing, showing that they do make a difference for purchasing and consumption, especially more rigorous and large-scale trials. Most importantly, among food access programs, mobile markets are favored among low-income communities. And so one of the larger, more rigorous studies that I just referenced was conducted by Dr. Leone and her colleagues in North Carolina, and that was the Veggie Van efficacy study. It was a randomized controlled trial in North Carolina. And after 6 months, they did find that what's known as the Veggie Van model made a difference. So mobile markets that were following the Veggie Van model, between comparing those communities to those that did not receive the Veggie Van model, there was a difference that amounted to about a 1 cup per day difference in fruit and vegetable consumption between the two treatment groups over 6 months. So what exactly is the Veggie Van model? It's a model that's intended to be implemented at a mobile market. It's rooted in social cognitive theory, and it has a few core components, which are pictured on this infographic. One of them being conveniently locate the market based on strong partnerships with organizations known as host sites. And those sites are already serving the target population of lower income households. Ideally operate the market weekly or regularly and extend the season beyond the peak growing season if possible. One of the components is to sell high quality fresh produce with a preference toward locally sourced, but it's not required. Implementing a reduced cost pay model to drive up that affordability, accepting any kind of incentives that are available in the region, especially Supplemental Nutrition Assistance Program, also known as SNAP. A unique component of the Veggie Van model is offering a produce bundle. You may see bundles at grocery stores. It's multiple items for a set price, in addition to selling individual items. And this is rooted in behavioral economics as a form of what's known as a health nudge to encourage individuals to purchase and consume more fruits and vegetables. And lastly, to build our self-efficacy, to actually cook and prepare meals and snacks with fruits and vegetables, cooking and nutrition education is a core component. So this leads us to our current Veggie Van study, which is our main focus in Dr. Leone's lab. And it's another randomized control trial. It's a 7-year, what's known as a hybrid implementation effectiveness study. And it's being conducted in 32 communities across 5 states with 9 partner organizations. I won't get into the process. We're actually in the middle of publishing a paper on the RFP process, which was a request for partners process to bring on the organizations for the study. And they had already been looking to launch or expand their operations. And so we've asked them to do so following the Veggie Van model. We give them funding to help with doing so and to do study activities, along with access to the toolkit, which is a web-based resource providing instruction on implementing the model, and technical assistance from our team. So the effectiveness portion is probably the first thing that might come to mind, especially in public health. What is this going to do for dietary habits, which is a main part of the study? We look at changes in fruit and vegetable intake and diet and health outcomes, among other things. But the other portion, the part that I geek out on, is the implementation portion, which studies evaluation factors at the organizational level. So our study participants here are actually folks that are implementing the VeggiVan model. And we're looking at how closely partners are following the model known as fidelity. And this dissertation research is nested in the implementation part of this larger VeggiVan study. So just to orient you as to what kind of research, just a quick primer on D&I, dissemination and implementation science. So here in this discipline, we're interested in how interventions that are evidence-based, also known as evidence-based interventions, I'll call them EBIs from here on out, how they're adopted, implemented, and sustained by the practitioners that they were intended for. It could be a school, which is what originally I was going to look at for dissertation plan A, a nurse, a doctor. In this case, it's individuals that work in a mobile market. So we're interested to see how things really play out in real world settings when we hand over an evidence-based intervention. So knowledge translation is a key piece of this, and it's the process of putting research into practice. For the VeggiVan model, it mainly takes the form, oops, that animation is not supposed to X out, but for the VeggiVan model, it mainly takes the form of the VeggiVan toolkit, which that was an image that just showed, as well as training for our study partners and technical assistants. But the process is easier said than done. Knowledge translation is pretty complex. A lot can be kind of lost in translation between evidence-based practices and the actual public health program in the real world. Toolkits are a great strategy to facilitate knowledge translation, but merely disseminating a toolkit doesn't guarantee its use. And it's recommended that we move away from passive diffusion to make sure that individuals are really engaging with the materials and able to use them. Ultimately, how practitioners implement an intervention has a significant impact on the individual level outcomes that we see. There was a seminal review of public health and prevention programs published by Durlac and Dupree in 2008, found that how well an intervention was implemented had a significant effect on effect sizes for the intervention. And in the context of mobile market research, what that would actually result to is we might not see a sufficient change in fruit and vegetable consumption, or what we would expect to see. So this research aims to fill a few gaps and needs, the first of which is that there generally is not a lot of research on mobile markets, especially from the point of view of mobile market operations versus the customer or the shopper. The studies that are available have indicated that there are operational and organizational barriers, but not within the context of implementing an EBI. Assuming that the VeggiVan model proves to be effective on a broader scale for the current study, it has a lot of potential to be scaled up across the US to enhance the public health impact of mobile markets. But we really want to be careful about helping it go to scale while remaining efficacious. So we can do this through continually improving how we translate the research to practice through our spread tools or the VeggiVan toolkit, as well as how we're supporting implementation tools such as training and technical assistance. And of course, we're always looking to contribute to the literature, in this case for D&I. So a quick overview of the two studies, which include 3 aims. The first is qualitative, in which we interviewed key informants from mobile market organizations across the US, with the aim of understanding operational challenges and mitigation strategies. We'll highlight the implications of these barriers on implementing an EBI in a mobile market to give us a sense of an organization's pre-implementation capacity. The second study is mixed methods, with the first aiming to understand facilitators and barriers to implementing the model through implementation interviews with our current study partners at 2 different time points. And the second aim focuses on the data from just the follow-up implementation interviews to associate those contextual factors with what's known as implementation effectiveness, or how well the partners are implementing the model. And that's captured through process measure surveys. That brings me to the theory of brings me to the theory or framework that informed all of these studies. It's known as the Consolidated Framework for Implementation Research, also known as CFIR. It contains the 39 constructs listed on this slide, which are nested within 5 major domains, and they all influence to implement, interact to influence implementation of programs and their eventual effectiveness. So quickly, intervention characteristics includes constructs that assess stakeholders' perceptions of the intervention. Outer setting includes constructs that assess how well an intervention meets the needs of, in our case, customers. Originally, the construct was patients because this was developed for a clinical setting. The domain inner setting includes constructs that assess complexities within an organization, such as climate and leadership. Characteristics of individuals includes constructs such as knowledge and beliefs about the intervention. And finally, process is exactly as it sounds. So the process of implementation from planning all the way to evaluation. So the first study is titled Operational Challenges That May Affect Implementation of EBIs at Mobile Markets. And this is currently under review with BMC Public Health. So a rationale for embarking on this research was, again, we recognized that there were issues, operational issues with mobile markets at the organizational level and within communities. But we're looking for additional context on these barriers and to place these barriers within a framework. So that we could see the implications for implementing an EBI, and also to identify solutions to help overcome these challenges. And so our main research questions were, what are the challenges established mobile markets face? What are the implications for implementing an EBI in the future? And what practices are mobile markets employing to potentially mitigate these challenges? And how did we go about this? So we recruited for this study online in 2018 through developing a database of mobile markets through exhaustive internet searches, past connections, and with snowball sampling. And we disseminated an invitation to an online survey that was a screening tool to identify organizations who were operating for at least 2 years. And we followed up via email or phone. Our interviewees, known as key informants, were representatives from mobile markets that could speak to the history and the details of operating a market. And we held up to 4 semi-structured interviews with them for about an hour and a half over the phone. And the original research question was actually common practices, which I'll explain how it ends up rerouting to challenges. And that was because for our request for partners process in 2019, we wanted to establish criteria for the organizations that would be applying into the study. And we were doing that based on this formative work. So again, our focus originally was common practices. We recently published in the Journal of Agriculture, Food Systems and Community Development, these common practices. But what happened during the analysis of all of that data, there was a lot of it. We used qualitative software for the analysis. Was that the theme of common challenges and remedial practices really came through strong. And we talked about the potential of breaking that off into a second research question, which we did. So we returned to the data and we analyzed it again, but this time applying the constructs of CFIR, which I showed you. And so what did we find? So the results are set up by CFIR domain and construct, which I'll remind you of what they are along the way. So the first is the domain outer setting, which are external influences on the market. And we identified barriers within the construct of external policy and incentives. So key informants cited a lot of barriers with enrolling in incentive programs, mainly farmers market nutrition program. There's a version for seniors and there's a version for the WIC program, Women, Infant, and Children. That there's a lot of challenges in terms of getting the right classification and meeting the requirements to stay on these programs. There were a lot of challenges regarding food handling requirements that prevent or greatly hinder the ability to do food demos at mobile markets, which are a preferred form of nutrition education. And within the context of the veggie van model, this has implications for implementing the reduced cost pay model, which is so reliant on having incentives available, and nutrition education. The majority of the challenges fell within the domain of inner setting, which includes implementation factors related to the context in which implementation takes place. And the construct structural characteristics has to do with an organizational size, history, and architecture. And a really big challenge that was cited in this work is that it's a really expensive business model due to not being able to break even and cover operating expenses through revenue, which is really challenging and at odds with being run by a nonprofit entity. So organizations are continually seeking out external funding to support operations. Staffing is a really big issue, high turnover and the expense of staff. This quote right here conveys that staffing is really so important to the experience, but it's a challenge to maintain and to fund. Within the context of the model, these challenges have implications for an organization's ability to implement and sustain the intervention. Within the domain inner setting, we have the construct implementation climate, which refers to an organization's capacity and receptivity for change. And compatibility refers to upholding an organization's mission. And so a challenge cited was that there was a mismatch between missions sometimes. So wanting to support local farmers versus marking produce down really low so it's affordable. And this quote conveys that there was a trade-off between sourcing between local farmers, which ended up being so cost prohibitive because the price that it would need to be marked down to make it affordable came at too great of a loss to the organization. Within the context of the model, this has implications for implementing the high quality produce procurement component, which doesn't require but does encourage prioritizing local produce. Within the domain of inner setting, but construct readiness for implementation, which is the capacity to implement, we have available resources, which is exactly as it sounds. So what resources are available? And challenges included significant expenses, vehicle just being one of them, but also produce and staffing, lack of funding and resources such as storage, and lack of expertise, capacity, and time, mostly described in relation to nutrition education. And this quote conveys, there always seems to be a crisis. And within the context of the model, this has implications for capacity to implement and sustain the model, as well as implement nutrition education. The domain process, and then the construct engaging involves attracting and involving the right individuals that should be involved with implementation. And in this case, we're talking about what's called innovation participants, which for a mobile market would be the customers. So challenges included earning trust in new communities. Many would like to start or revive a community advisory board to get that deeper engagement with the community, but lack the capacity to do so. Snap transactions serve as a really helpful way of, serve as a proxy measure for determining who you're reaching in the low income population, but it doesn't include folks that are low income, but not on these programs. So don't have a full sense of who they're reaching. And this quote from a Michigan key informant highlights how long, in this case, 6 months, it took for their market to be acknowledged and patronized in a new community. And so within the context of the model, these challenges have implications for the reach of the model. And again, within the domain of process and construct of engaging, but this time engaging stakeholders, specifically host sites, the sites that are helping to host the market. They express challenges with working with host sites in terms of a lack of clarity on their role. Organizations also have challenges such as negotiating with farmers for a fair price while ensuring high quality produce, because they notice that sometimes in that negotiating process goes a little bit differently if you're coming from a small nonprofit entity versus a business. And so this quote from a New Mexico informant highlights the frustration of a host site not being clear on their expectations of a partnership. And within the context of the model, this has implications for the component of host site partnership, also the high quality produce procurement, if the stakeholder is a farmer, and the reach of the intervention. So there were a lot of practices that could potentially mitigate. It's a huge chart that went into the manuscript, so I just took a sample out of there. So soliciting investment in the market, maximizing profit from services, or implementing what's known as a cost offset model might be strategies to counteract the issues with available resources. Restructuring staffing models to shift to more of a reliance on community champions or volunteers, or implementing a train the trainer model may help to overcome challenges with staffing and capacity. Forming strategic partners, such as with Department of Social Services or with farmer coalitions, could help with procuring local produce and enhancing the reach of the program. Extending the market season could help with deeper engagement with the community and enhancing the reach. And conducting formative work, such as focus groups or striking up more formalized agreements with host sites or being very clear about expectations, could strengthen engagement and enhance the viability of sites. So in sum, this study supports past findings on from the couple of studies that were available that reported on challenges, but we've added additional detail and context, looked at the context within an implementation science framework to identify the potential pain points for implementing an EBI in the future, and also highlighted some mitigation practices. Study 2, Aim 1, is titled Facilitators and Barriers of Implementation of the VEGI-VAN Model Among Community Partners in a Multi-State Trial. So with the last study, we further confirmed there are challenges among organizations. We've aligned that within contextual factors for implementation. And now we're going to more narrowly look at that context within implementing the VEGI-VAN model specifically by asking the question, what are the facilitators and barriers of implementation of the VEGI-VAN model among study partner organizations? And onto our methods. So our participants for this study were current partners in the randomized control trial that we ran the RFP process for. It ended up being 6 out of 9 of the organizations, because the other organizations have organizational priorities that they had to focus on or pandemic delays. We spoke with 4 representatives from each organization, whoever was working the closest with implementing the model. And we developed a baseline and a follow-up interview guide. Baseline was shortly before or after market launch. Follow-up was about 9 to 12 months post-market launch. And it was designed to understand the experience of implementing the model. But due to the timing of the results from the last study that I just reported on being available, it was mainly the follow-up guide that was informed by the CFR constructs that were identified in that work. It was mostly qualitative. There were some quantitative questions that we piloted, and they were quantitative versions of CFR constructs and self-efficacy on a Likert scale of 1 to 10. And the baseline interview guide included a very cool validated measure called the GRIT scale, which measures trait level perseverance and passion for long-term goals. And our interviews were semi-structured, about an hour and a half, and we interviewed each individual separately. The analysis was exhaustive, and it's funny that it's put into 4 bullet points here, but it took months. We did a multi-pass thematic coding of all interview data for both time points, with an iterative code book that was utilized throughout the process and reconciled all codes between coders. Here's an example of, especially for those who are new to qualitative, what coding of just one small passage of text looks like. So this excerpt is in response to the question, how has implementing the model provided an advantage for your organization? And so we first did a deductive sorting by CFR domains, which was pretty straightforward based on how the interview guide was set up. In this case, it was outer domain. And then inductive sorting included, this is where the exhaustive comes in, what's known as open or free coding. And the code for this passage was, implementing an EBI gives organization an advantage. And then lots of discussion and cleaning up of a code book to create subcategories and categories, such as model advantage, facilitators, and the appropriate CFR constructs. In this case, it's peer pressure. So that's just for one small passage of text. For quantitative data, we did simple descriptive statistics, including means for Likert scale, responses, and self-efficacy, and for the GRIT scale, but I'll speak more on that in the next study. It's reported with the 3rd manuscript. And so what did we find? So we have a new domain, intervention characteristics, because we're talking about the VEGV model specifically. And this includes attributes of the intervention that influence the success of implementation. And relative advantage refers to perceptions of the advantages of the VEGV model. And the need to require more staffing was a cited barrier, as well as the reduced cost pay model for those who were accustomed to doing free food distribution. Although the model was cited for helping with formalizing practices as a facilitator. Complexity is exactly as it sounds, how difficult representatives perceive implementation to be. A barrier being that some of the components were very complex, like offering a produce bundle or extending the season. Whereas a facilitator was launching the model at new sites rather than converting old sites. And this quote highlights that bundling in the form of meal kits was seen as difficult because they had no experience with it. The construct cost of intervention refers to costs associated with implementation, and a barrier was perceptions of increased costs, mainly for nutrition education. And a facilitator was that there was a perception that the model would actually cover, maybe even reduce program costs. Like this quote indicating that they think that bundle sales will actually cover any increase in costs associated with implementation. For the domain outer setting, we have the construct customer needs, and a big barrier was that some organizations received pushback for some model components. Specifically, bundling was an issue. A facilitator was that the model was seen as a way to help meet community needs. The construct cosmopolitanism refers to how networked an organization is, particularly with other VEGV model implementers. There was no barriers, but a facilitator was that folks emphatically talked about how beneficial it was to network with other practitioners, especially those implementing the model. And this quote highlights the first construct, customer needs, just about the pushback for the bundle. Didn't go over so well with the elderly and with families. I like how it says, they're really not trying to also buy half the table. So we've seen this construct before, external policy and incentives, and a barrier was navigating those regulations such as health code, and it could completely impede conducting nutrition education, whereas having a strong relationship with the health department helped with navigating. Not related to health codes, but this quote conveys that there's barriers with participating in SNAP as a vendor. You have to provide an individual social security number, which this organization, among others, aren't really comfortable with. And offering SNAP is really key. Within the domain of intersetting and the construct of implementation climate, we have the subconstruct tension for change, which is exactly as it sounds. So tensions or concerns regarding implementation. Barriers were organizational concerns for meeting recommendations and long-term sustainability. And facilitator was that some were really looking for that extra push or motivation to launch or improve their mobile market programming. So the model was really a welcome change. Compatibility is in reference to how it aligns with their mission. And a barrier is a conflict between organizational mission and certain model components. Pay model was one of them. Facilitator was if there was perfect alignment between mission and model. And this quote highlights that mismatch between the reduced cost pay model for an organization that formerly did free food distribution. Access to knowledge is an organization's ability to access digestible information and tools to help implement. A barrier was that the model training was not timely in some cases, mainly because of institutional funding delays related to the partner study involvement. Facilitators included organizations were utilizing the technical assistance, and they had lots of requests or suggestions of things they'd like to see with training and resources to help with implementing the model. And the subconstruct available resources, barriers were insufficient funding, resources, and time to implement. And unsurprisingly, the facilitators are the opposite, more funding, resources, and time. And this quote conveys how critical staff are to operations, but finding funding for the staffing is really challenging. And the domain process construct engaging with stakeholders, which again are the host sites and then other integral stakeholders in the community. A barrier was a lack of support, also from local governments, and they're not deeply engaged with the community. Whereas the facilitator was the opposite, having that reliable support from partners in government, especially when the partners are really deeply tied to the community and sharing resources. And this quote conveys working directly with farmers, developing those relationships and leveraging that support for things like season extension. So these findings highlight the important factors that can either help or hinder the implementation of the model. Perceptions of model complexity persisted between baseline and follow-up. However, concerns based on the quantitative questions, the concerns for meeting the recommendations did remain relatively low, 3.9 and 4.3, but there was a slight increase between baseline to follow-up. Average individual perceived difficulty on a scale of 1 to 10, with 1 being the easiest and 10 being the hardest, did increase. So difficulty increased. You could also think of it as a decrease in self-efficacy for the difficulty for implementing the model. So these things should be noted. Average ratings of concerns for cost associated with the model were relatively stable, hovering at about a 4 for baseline and follow-up. But the qualitative data did show that there were still very real concerns for how folks would sustain the model at follow-up. Other factors that play a role in implementing the model are whether there's a perceived advantage to the organization or the community, how well the model aligns with the organizational mission, connections with other implementers, and the strength of the relationship with stakeholders, organizations' ability to navigate barriers, and whether an organization has access to and finds utility in the VeggiVan model resources and technical assistance. So final study, study 2, aim 2, is evaluation of the implementation of the model using CIFR. And with this final aim, we seek to understand to what degree are partners implementing the model, and then associating those implementation outcomes or effectiveness with the contextual factors through asking the question, which CIFR constructs explain variation in implementation among current VeggiVan study partners? And our methods. So just to orient you as to where we pick up with aim 2 of the study, we used qualitative data from the implementation interviews conducted for aim 1, but only the follow-up data was utilized to write what are called organizational case memos. This was combined with quantitative data from process measure surveys that was used to categorize implementation effectiveness among partners, ultimately combined to create a CIFR construct matrix to look at how the factors compared to how well participants implemented the model. The process measure surveys, this is a pretty core component of implementation science, tracking the process. They're completed on a monthly basis by study partners. Usually one representative is designated to complete them, and they're designed to capture implementation outcomes, adoption, and fidelity and adaptation. The choice of those outcomes was informed by Proctor et al.'s taxonomy of implementation outcomes. There are several, but we focused on adoption, which asks questions like, did the partner organization implement the model at all, or which components were implemented? And fidelity, which asks questions like, did the partner organization implement the model as intended, or what adaptations were made? For the quantitative data, which included process measures, we conducted simple descriptive statistics for process measures organized by model component, such as average number of operating months or months offered a bundle, to be used to categorize the implementation effectiveness. And we modeled our methods after the creators of CIFR, Damschroeder et al.'s 2013 evaluation of the program VA Move. And we established criteria to be met for different levels of implementation. We ended up setting 2 levels, transitional and low. And the transitional implementers had satisfied all of these criteria that are bracketed for convenient location, reduced cost pay model, in addition to also implementing bundling, local produce procurement, and nutrition education at least some of the time. Low implementers failed to satisfy all criteria for convenient location, reduced cost pay model, and or have implemented any of these at a frequency of never. So the bundling, local produce procurement, and nutrition education. So for qualitative, again, we took the qualitative data from the first aim and took it a step further. We took the follow-up data and we wrote organizational case memos that were jointly written between myself and this independent coder, a research assistant in our lab, and summarized the qualitative data for each organization organized by CIFAR constructs. We again modeled Dan Schroeder's methods for doing what's called a CIFAR construct rating, and each case memo was independently rated on a scale of -2 to +2. The valence represents if the construct has a positive or negative impact on implementation, and the magnitude represents the strength of that construct. 0 would be applied if there was missing data, if it was conflicting, so representatives were just really not in agreement about how something impacts implementation, or if there was generally a neutral response. And so what did we find? I'm not going to go through this whole chart, but just to give you an idea of what the CIFAR matrix looks like, this is only half of it. This is a portion. And so the darker gray are our 3 transitional implementers. And on the right-hand side would be the low implementers. And all of the ratings are populated in there. And then on the left-hand side are all of the CIFAR constructs. So we identified, or we honed in on the constructs that had 2 or 3 point differences. Here we have a 2-point difference, and that was determined to be weakly distinguishing. And a 3-point difference was determined to be moderately distinguishing. So these constructs are weakly or moderately explaining through a CIFAR construct why there's a difference in implementation between the groups. And so just honing in on those few constructs that made a difference. For intervention characteristics, we have relative advantage, and this was weakly distinguishing. The transitional implementers identified how the model benefits their organization and the communities they serve, whereas the low implementers had either no or mixed responses. For complexity, which was also weakly distinguishing, the transitional implementers did not necessarily view the model as very simple, but the low implementers viewed several model components as very complex. And this quote is in reference to attempting to implement the reduced cost payment model when formerly doing free food distribution, and it was pretty complicated and difficult. Cosmopolitanism was also a weakly distinguishing construct. Transitional implementers were actively accessing and utilizing networks with other practitioners, including those implementing the model. And this quote conveys how beneficial that was, even just via email. Peer pressure was also weakly distinguishing. Transitional implementers viewed the model as advantageous to their organization, and they actively network with other organizations implementing the model, whereas low implementers highlighted the benefits of the study, but not the model itself, and did not have a sense of whether or not other organizations were implementing the model, which comes through in this quote. Tension for change was our sole moderately distinguishing construct, with transitional implementers demonstrating low concern for meeting model recommendations and for the costs associated, whereas low implementing organizations had higher mixed concerns for meeting model recommendations. And the quote illustrates that the model was a welcome change in helping with filling gaps in organizational practices through encouraging organization. And planning was a weakly distinguishing construct within the domain process. The transitional implementers described an extensive strategic planning process among key individuals that were involved in initiating and implementing the model, whereas low implementers expressed no planning related to the model. And so this quote illustrates that extensive strategic planning process. And for engaging stakeholders, which was also weakly distinguishing, it actually was opposite to what we expected, where the low implementers provided examples of high-level support from host sites, whereas transitional implementers expressed frustration with host sites. And so this quote shows actually a low implementer describing that high level support from a partner that's helping with the bundles. So our main takeaways from this research are that organizations with higher receptivity to implementing a new intervention recognize the advantages of that intervention, perceive it to be less complex, have clear planning and goal setting processes, demonstrate higher levels of implementation. And utilizing networking opportunities with other practitioners and recognizing the advantage that implementing an intervention gives an organization may also help to enhance implementation. And so in conclusion, tension for change was a moderately distinguishing construct in our research. And this is supported, and the importance of this construct is definitely reported in the literature. It's also further supported by our quantitative responses from the interviews that indicate that the 3 transitional implementers, so the ones that were implementing a little bit better, had the lowest within organization average rating for concern about meeting model recommendations. So 1, 2.3, and 4.5. The range for all organizations was 1 to 9. I think this is pretty cool. 2 of the transitional implementers earned the highest average combined grit score at baseline, 4.1 for both of the organizations out of a possible 5 points, which would be the grittiest. And the range across all organizations was 3.3 to 4.1. Interestingly, tension for change was often described in relation to how complicated the model was, which is complexity, the means to implement, which is available resources, or how well the model aligned with their mission, which is compatibility. But out of those 3 constructs, complexity was actually only found to be weakly distinguishing. But even our weakly distinguishing constructs have all been reported in the literature to make a difference with implementation in other realms of research, mainly related to HPV vaccination and HIV PrEP. And again, the literature does say that higher engagement is usually seen among higher implementers, which is counter to what we found. A thought that I had was that perhaps the different types of implementers had different perceptions of stakeholder support. So transitional implementers may hold stakeholders to a higher standard, which is why they may fall short. And lastly, we can't rule out the possibility of organizational size and experience playing a role, but we would expect that if it did, that the construct's structural characteristics and available resources would have been distinguishing, but they were not. One of the transitional implementers did have over 10 years experience and is a medium-sized organization, but they did say that several of the components were complicated to implement and were new to them. And also one of the other transitional implementers was very small and had less than 1 year of experience. So both ends of the spectrum. And to wrap it all up, we've confirmed and expanded on the many challenges faced by mobile market organizations. We've applied an implementation science framework to assess pre-implementation capacity. We've proposed solutions that may help to mitigate challenges, applied CFER to identify facilitators and barriers to implementing the model, and we've associated those constructs to implementation effectiveness. And so in closing, our limitations, implications, and future directions. So first, our limitations, or I like to think of as lessons learned. We do have to acknowledge our study sample. In the first study, we spoke with more experienced organizations, which it may not be generalizable to more nascent organizations. And also working with study partners for the second study, they may be more able to implement because they get so much support from the research team. We also focus mainly on urban regions because the VEGGIE-VAN model is designed for urban regions, but it may not translate to rural. I have been very involved with helping with partners. I know the partners very well. So of course that could introduce bias, but we did a really rigorous 2-coder protocol to help mitigate that. And our participants ended up being kind of confused between study activities versus VEGGIE-VAN model components. And we'd like to think we did everything we could to remedy this between baseline and follow-up interviews. But it's also a lesson learned for future endeavors in our lab. We did have a fair amount of missingness for our quantitative responses and our process measures. So we did the best to recover from that. but we can't make longitudinal inferences from that. Our process measures has some work to do. It was not designed for pandemic times. We had missingness, different interpretations of the questions and components, so we're going to rework it. Of course, our small sample size limits generalizability and ability to run statistical tests of significance. And because of the study design, we can't really be certain that the constructs are associated with implementation effectiveness. And of course, the pandemic. That was huge. So it really hampered implementation, but it also made for a really kind of cool way of seeing how they adapted the model. And in the interviews, the representatives were really good about making distinctions between when it was the pandemic making things complicated versus the model itself. So we feel like we teased that apart pretty well with data collection and analysis. And so in closing, limited organizational capacity was definitely a recurring theme. This wasn't a distinguishing construct, but we feel that additional strategies and support are definitely needed. Things like business advisement to help reconcile missions between nonprofit, but also having enough business acumen to remain sustainable. Also ways to build internal capacity without needing external funding. This does include generating solutions for sustainability, which may help alleviate concerns for costs with implementing the VeggieVan model. And this is something that the VeggieVan research team is currently working on with some side projects. Support for navigating regulations, such as health regulations, are also needed, but policy reform probably as well with navigating the SNAP and incentive programs. Our first manuscript made a lot of recommendations that do actually need to be evaluated to see if they actually work. And given that funding and staffing are such persistent and formidable barriers, we should assume that most organizations are operating under conditions of scarcity, and we should determine what minimal resources are needed to implement the VeggieVan model. There's an opportunity to refine the intervention itself, such as the host site partnership component. We're thinking about maybe more narrowly defining it to choose not only partners that are serving a low-income demographic, but also deeply embedded with the community or even representative of the community. And the pandemic also showed us that we may have to detail several versions or options of the model components, such as different types of bundles or different types of nutrition education, see if that changes the efficacy of the model. During the pandemic, a lot of people switched to virtual nutrition education, which we're still trying to wrap our heads around what that work looks like and if it still works. A major takeaway from this research is that we recognize the need to expand and refine our tools and support system, also known as our training center. So there's a need for a clearer definition of model components, explicit guidance on implementation, and requests for specific materials and training should be heeded. So we're in the process of expanding our lab into a bona fide VeggieVan training center to provide training and technical assistance. And in doing so, we should update our tools and support system, keeping in mind all of the findings from this research. So decreasing perceptions of complexity, highlighting advantages and adaptability, maximizing self-efficacy, helping to mitigate concerns for meeting recommendations, increase transparency of costs, and provide a roadmap for engagement and execution. Of course, any kind of improvements that we make to our model, resources and tools, we should evaluate.
Are you someplace?
Oh, whoever, oh, I think we're good. That we've invested our time and resources wisely. And these findings can also inform what the screening or onboarding process looks like. Organizational readiness can predict a greater degree and more effective implementation efforts. And this could be applied to our screening process. So this could be a great opportunity for identifying any mismatches in values between the model and the organization's mission or the community needs. And we can address that through either tailoring the model or perhaps just recognizing that it may not be a good fit for an organization and forego implementation. We recognize that the importance of creating network opportunities between implementers. And this is something partners have been very emphatic about the benefits, especially with our Mobile Market Summit. And more precise instruments are needed, such as quantitative CFR measures, which I hope to maybe personally get into with the postdoc to be sure we're accurately capturing constructs. Reliable and validated quantitative CFER measures will allow us to evaluate mediation and moderation between constructs, which would be pretty interesting. And definitely more work with refinement for methodology for categorizing implementation effectiveness, applying and interpreting the CFER construct ratings. We met with Dan Schroeder's colleague, but we were still left a bit kind of lost as to what the methodology was. So we did our best, and we're going to report it in the manuscript as to exactly what we did. And the grit scale has mainly been utilized on an individual level to predict academic performance. Highly recommend the book by Angela Duckworth, who developed this scale. To our knowledge, this is the first study that's calculated an aggregate organization grit score and compared it to implementation. We hope to connect with the researcher to see if this is appropriate, what would be the best way to do this. I did try to reach her, and potentially use this in implementation science again. That's me doing a food demo at a mobile market years ago. And I do need to acknowledge my amazing advisor, Dr. Leone, for all of her amazing guidance and support over the years. It's been such an enriching experience to be so completely trusted, but also challenged to become, to grow as a scholar over the years. Of course, I need to thank my esteemed dissertation committee, Dr. Holmish, Tamil Berhalter, Dr. Ansman Frasca, and Dr. Moore for your expertise and guidance on my dissertation research. I hope to still learn from you in the future years. The Vegivan co-Is for all of your guidance and creating a welcoming environment for me to learn and thrive, and for your support throughout the research process. All of my friends and colleagues with our lab, CHIL, for your support, friendship, and humor, especially Leah Vermont, who is our powerhouse project coordinator. And a special shout out to Annie Canizares, who is the MPH MSW grad student that helped with this exhaustive research, along with the other research assistants, Deanna and Julia. But Andy probably didn't know what he signed up for, but he totally rose to the challenge, and he just did an incredible job. I don't know if I worked that hard when I was working on my master's. And of course, everyone in the department, the PhD students, faculty, and staff, all of my mentors in the city of Buffalo that actually I was going to run research in the schools with. You've just inspired me. You inspired me to get my PhD, and you still inspire me, and I hope to still work with them in the future. All of the participants I worked with SNAP and WIC, of course, the mobile market representatives that were part of this research. They're some of the greatest people that I know. And just a very quick dedication, but the most important, to my family for all their support. My stepdad, as Lucia mentioned, my mom and my grandma who raised me, they both passed during this time. So this is really all for them. And all my friends. And my cats, and my baby on the way, who's the best motivator I could hope for. And I'm done.
All right. Thank you so much, Christina. We have a couple minutes, just a couple minutes for questions from non-committee members. If anybody has a burning question they would like to share, please go ahead. Please feel free to unmute and just ask your question.
Christina, I just want to say congratulations. That was an excellent presentation, dissertation. And I just want to ask, what was your favorite part of going through this research, and what was your biggest takeaway from it all?
Well, my favorite part is definitely talking to the mobile market representatives. I think qualitative is such important research, although I am interested in getting more into quantitative. So learning about the experience, it's really interesting. Not that I expected mobile market representatives to be, less qualified, but they actually, for the most part, because I've run so many interviews over the year, have such a phenomenal public health background. So they really understand things like the socio-ecological model, and that this is really just one part of so many other things that are needed in food access. So just that broader public health perspective, it was just kind of surprising to see that they all really understand it. And I think that the final aim with the mixed methods is really quite cool. And I would really love to meet with the folks that develop CFIR and bring that methodology even further. I think it has a lot of potential. It's just the methods aren't really reliably reported. And so we kind of had to decide some things on our own. And I think there's some potential to come up with some standard methods.
Excellent. Well, thank you so much, and amazing job again.
Thanks.
Any other questions? All right, well, thank you all for joining us today. Sorry, I know we didn't have a lot of time here at the end for questions, but for those on the dissertation committee, we're going to take about a 10-minute break, and then we can join back on this Zoom to